Having dementia doesn't mean the end of your life. For me, I think it's been a complete new beginning. We mustn't forget those people that care for people with dementia, if you are still able to do something to help yourself. I think we must try. If you need somewhere or somebody to go to apart from your family, you need somebody on the outside to talk to. It has been quite an experience in two different ways, frightening and enlightening. Even having dementia, I still have an awful lot to give because it isn't the end. For me, it's my beginning.
I'm not a big believer in having one access point for people, because I think people go to naturally wherever it is that they feel comfortable to get information and advice. The most important thing about helplines is about tying them up so that the information that you get is consistent, is equal, that people can help you and signpost to the right areas. Diagnosis is one thing, but actually that doesn't define a person. It's the rest of their life that defines them. It's also about giving people the skills and the tools and the information to be able to go forward and cascade that to either others in their family or in their community or within their volunteering roles as part of the memory cafes. So we're trying to really cascade lots of that information and distill it from specialist agencies out to the community.
But we're all working together to set up a network of cafes across Cornwall. Some really look at providing informal respite to family carers. Some really concentrate on activities for people with memory loss. But most of all, it's about the chance to socialise, have fun, and maybe rebuild some of those social networks that have fallen away. What is really amazing is that most of the work at the memory cafes are done by volunteers, people drawn from those local communities. And what is really evident is that volunteers keep coming and guests keep coming because they really enjoy what we do, even when we do a lot with very little, so that there isn't statutory funding for the memory cafes. But the experience across the county is vast. We have the Alzheimer's Society, we have Rotarians easing problems of dementia, we have Memory Matters, we have Cornwall Care, we have all these organisations that help supporting local people to do amazing work.
I think the medical profession was almost disengaged from the people with memory problems and dementia, and the NICE guidelines were more interested in making a diagnosis, having CT scans, having SPECT scans, telling you which sort of dementia you were likely to have, and whether you had Alzheimer's or vascular dementia or Lewy body, how quickly it might develop. Part of the important thing is trying to find out what everybody else is doing and how it fits in with what you're doing. And all of these things, I think, are important. And I don't think both GPs or consultants in secondary care are aware of all the things that's happening outside the medical profession, most of which is far more important to patients than what we're doing. And I think it's about educating and being aware of each other. Every patient that you diagnose is different. I had a patient who was a very good golfer, and he'd been a county champion, and he was 72, and he got early dementia. He didn't need really very much support. He was playing golf 3 times a week. He started to win on a regular basis, which seemed to be odd because he seemed to be going around and winning every competition he went into. And people seemed to think that really he hadn't really seemed to have played that well, and they couldn't quite understand, which if you come second to this chap on a regular basis, you probably get a bit fed up with. And it turned out that he couldn't remember his score. And rather than getting chucked out of the golf club as being a cheat because he'd won the last 5 competitions, all he needed was somebody to mark his card for him. That was all he needed. And he'll still win the odd competition, but he won't win every one.
The Department of Health produced the dementia strategy a little while ago, and that's been refreshed and revised with the focus of the new coalition government's drive for quality outcomes. That's really welcomed, and as an organisation, we're going to be measured and monitored about the experience that we give to people. So it really makes us think about the services that we're giving. Education is really important. This year we're committed to making sure that the awareness of dementia across our whole workforce, so that's just not with our clinical staff, but with staff in our back offices, the porters on the corridors, that we have the housekeepers that are working hard with the clinical team supporting care, have a broader understanding of the needs of people with dementia in our service. We've had multi-million-pound investment in our hospital site with new equipment, new technologies being brought in on all 3 sites, and as part of that we're refreshing the clinical environment as we go through. So ward and department areas are having better enhancements that provide better orientation and support for people with dementia.
It used to be said that everyone, including the postman, knew that someone had dementia before GP and specialist services did. I think we're now moving towards a situation where we realise that dementia is a multifaceted problem. It affects not just the patient, but carers, family, a number of other individuals. And I think we're really moving in Cornwall towards providing a very integrated service, of which I think, you know, Jodie and I are representatives of just one part. Diagnosis, early diagnosis is important, but it can be complicated, and I think a specialist service is important in that process. Because we need to identify that it is dementia that we're working with and not perhaps other conditions that mimic it.
We use the Adam Brooks cognitive examination, which is a series of questions which looks at orientation to date and time. It also looks at language skills and fluency, and also some visuospatial skills, which helps us to pinpoint some of the areas that people might be experiencing difficulties with. Within the post-diagnosis stage, we then again bring back what is their diagnosis, and really it's an opportunity for the person to ask questions that may be relevant to them, but also give them further information about their diagnosis.
Anyone can refer a person with dementia or suspected dementia to our service that permanently reside in one of the 98 care homes. Likewise, the same criteria does apply for people within our community hospitals who are not in receipt, who have never been in receipt of any of our Cornwall Partnership Foundation Trust services.
Okay, so what do we actually do for people with dementia? Firstly, we ensure a formal diagnosis has been given and the person is registered on the GP's QOF register. The QOF register is the Quality Outcome Framework Register. Our aim is to prevent unnecessary transfers to alternative and acute settings, ensuring that people with dementia receive high quality care in the care home environment itself.
Adult care and support can provide help with things like personal care and home care, with meals, with sitting services, with equipment and adaptations and things like assistive technology, with daycare and day activities, and with short breaks and respite care.
What we want and what we're striving for is that every single professional and support worker is aware of what dementia is, so they can provide excellent care for people with dementia wherever they go.
Advocacy is about helping people express their own wishes and feelings. We help people explore what options are available to them by giving them information so they have choices themselves. A lot of what we do is helping them access support and other services and to assert and promote their own rights. We use talking mats a lot, photographs, pictures, whatever method the person is most at ease with. I think one of Nick's pieces of work recently, her client, was pretty much non-vocal and was facing quite an important decision about where she was going to live, and how Nick managed to support this woman in expressing her wishes was using some poems the woman had written 20 years ago. In the poems, it was really apparent that being isolated, peace, quiet, being on her own was really important to her. So maybe being in a really busy nursing home wasn't the best option.